Today, our webinar is Women, Children, Families, and the COVID-19 Vaccine. We brought this together because as we continue to be mired in this COVID-19 pandemic, there's an intense drive to get Americans vaccinated as quickly as possible in an effort to defeat this virus. Today, our webinar will address some of the questions prevalent in our community, which may lead to COVID-19 vaccination not being sought. So I'm Robert Giles, the Assistant Medical Director at Clara Maass Medical Center in the Emergency Department. What I'd like to say is one of my earliest motivations for becoming a doctor grew out of the lack of seeing someone who looked like me when I went to the doctor. Of course, I want to treat and heal all patients, but I also want people in my community to know they have someone that empathizes and can relate to them, someone they can trust and give them comfort when they are most vulnerable. We all know the troubled history and previous atrocities carried out by the medical community against African Americans, but we're all here to try to guide our community in what's the best way to protect themselves. Additionally, there is so much conflicting information surrounding COVID-19, which leads to further confusion and mistrust amongst our community. With these challenges in mind, our physician panelists will lend their voice and expertise to addressing questions surrounding the COVID-19 vaccines, emphasize the importance of COVID-19 vaccines, and hopefully allay some fears about getting vaccinated. Now, before we start, I want to thank the Links Incorporated for helping to organize this event, specifically the North Jersey chapter of the Links. So without further ado, I'm going to introduce our panel. We have Dr. MacArthur, Director of Obstetrics and Gynecology at Barnabas Medical Center. We have Arnold Williams, Dr. Arnold Williams. He's in psychiatry at the Barnabas Behavioral Health Center. We have Dr. Michael Straker, Chairman of Maternal Care Services, Hello. Clara Maass Medical Center. Nelson Aluya, Dr. Nelson Aluya. He works in internal medicine at Newark Beth Israel Medical Center. Just one second. And we have Leah Dungy. She's the nursing director for Maternal Health Services, Jersey City Medical Center. And I think Dr. Ford has joined us as well. He's internal medicine and he works at Wood Johnson University Hospital-Rahway. So to make our webinar informative, we have some questions. We're going to start off, this is a question for everyone, and we're just going to go through it in a round-robin fashion. So the question is, there continues to be a tremendous concern about the safety of COVID-19 vaccines, which has resulted in a gap of vaccination rates between white Americans, Black Americans, and other communities of color. From your perspective, why does that gap exist? And I think we'll start off with Dr. MacArthur.
Okay, for me, my opinion is there's a lot of misinformation and just past historical problems with Blacks and feeling that they're experimented on. So I think that leads to, within the Black community, a certain amount of distrust. And I think the goal for us as physicians is to clarify some of the misinformation that's out there.
Okay, next, if we could get some input from Dr. Ford.
I think Dr. Ford may be having some trouble with audio. I'm not sure. Stacy, can we figure that out?
Okay, we'll wait for him to overcome his technical difficulties. Maybe Dr. Straker, you could jump in here while he's getting that worked out.
I totally agree with Dr. MacArthur. I think, and what you said before, Dr. Giles, is that we can hear you, Dr. Ford. Can you hear us?
Can you hear me?
We can hear you. Yes. Good. But I think the past atrocities that we've seen in the African American community really takes us to a point where we are more hesitant to get any kind of care. So when you have a vaccine that's been developed in what they say is warp speed, during an administration that wasn't really friendly towards African Americans, and you're unaware of the individuals involved in the creation who look like us, then you don't really have the confidence in the vaccine. So I'm glad we're doing this. I'm glad RWJBarnabas Health and the North Jersey Links have put this panel together in order to kind of dispel some of those myths and give us that the knowledge needed to make an informed decision and not a decision based on fear.
Okay, so let me try this. How's that? Can you hear me now?
Yes, we can. Yes, we can. You wanna jump in there?
I think we can hear him, but I don't think he can hear us.
Okay. Okay, let's just go on down our panel. Dr. Williams, you want to jump in while they work on getting that worked out?
Sure. I echo what everyone has said. Sometimes people don't realize also that there can be limited access, literally from zip code to zip code in different neighborhoods. People don't always get direct exposure. There's the term, pharmacy deserts, the idea that you have areas that are clearly underserved, regardless of whether people want to get the treatment, or in this case, something that's preventative. Healthcare in general more focuses on treating something once it happens rather than what we can do to make sure it doesn't get bad in the first place. And that type of mindset means that many people will wait until the very end to actually do something about it. And so getting that education out, that this is one of those rare opportunities that we have in real time to prevent disease. And the more people that participate, then the better off we're going to be in the long run.
Yes, I often see that in the emergency department where people are getting to me too late when they could have been doing things on the forefront. And hopefully forums like this will spread the word, and we can definitely be more on the preventative side than treating someone in a compromised state. Dr. Aluya?
Well, thank you very much. Good evening. It's a pleasure to be amongst this great panelists. Good to see you all and see Black brothers and sisters who are doctors out there doing something great for the community. Often enough, it's so difficult when some patients see me as a doctor and then, oh, he's a Black doctor, and they're surprised. And that's where this comes out from. Other than the historical reasons and some biases that they've had all through history, in our community, trust is a big issue because often enough they're not being taken care by people who look like them, so they don't trust what is being given to them at this time as regards to the warp speed developed vaccines. And again, the issue of information. What information is put out there by who and directed by who? And are they people who they know, who they trust well enough? So our community is usually very communal. We tend to share information amongst ourselves for historical reasons as well. So at this time around, that's how that mistrust, misinformation, and misconception is perpetuating in our environment or in our community, and that's why we have this disparity that we have right now.
Yeah, I must say I appreciate Barnabas Health and the Links for putting this together so we can get the word to our community in a fashion and some folks that they can recognize, that look like them, who can garner some trust and maybe feel like they're getting some correct information instead of, all these things on YouTube and some really far out things going on. Ms. Dungy, do you want to make some comments?
Sure. I, again, echo the rest of the panel. I think that there is a combination of misinformation from social media. Many conversations that I've had with family members stem from information that they have gotten from Facebook and Instagram, which makes it a little challenging to discuss. But my father grew up in the in deep Virginia. So the trust issue when going to the doctor is real. It's realer, I think, than I personally, in my experience, could ever imagine. But it is. He always he makes says the example. He's definitely afraid to go to the dentist because when he was younger, when you went to the dentist, you had a cavity, they pulled your tooth. There was no filling it. There wasn't trying to fix it. There's no root canals. It was like, okay, you got a cavity, it's done. So the trust factor is huge.
Okay, how we doing there, Dr. Ford? Can you hear me?
Now I can hear you. Yes, I can.
All right, sir. You want to jump in here?
Not having knowledge of what the other panel has said so far, I will say that trust and fear have been issues in our community for many times. For a long time, and even today, we have modern day healthcare disparities that are ongoing. So I think that mentioned before, the embers of those particular things just fuel a fire that continues to this very day.
Yeah, I appreciate everyone donating their time. When I'm in the emergency department, when I talk to my patients, when I explain to them, they say this vaccine hesitancy, but as Dr. Williams alluded to, you have to have the opportunity to be hesitant. So access is a big problem. So education and access, I think, will push us much further along on that path toward getting everyone vaccinated, or at least getting our community to be more willing to get vaccinated. So Dr. Ford, we got you online. I'm going to come back to you. Since not everyone in my household wants to get the vaccine, does a vaccinated person present a risk to unvaccinated family members in the same household?
Thank you for that question. Before I answer that question, I would like to say I think we should talk about what the vaccine can and cannot do.
Sure.
First of all, there are, as you're well aware, there are 2 mRNA vaccines, and the third vaccine, which is the J&J vaccine, has been tabled for a while, and I presume that later on this week they're going to go ahead and release that again. But having said that, the mRNA vaccines give you about 95% protection against standard COVID-19 virus, but they do not protect you 100% against acquiring the virus. So, they also do not contain infectious SARS-CoV-2 virus particles, which could give you the virus. And it is a misconception that getting the vaccine can give you the virus. Now, having said that, knowing that you can get 95% protection, there's that extra 5% that you're not getting. So the short answer is yes, a vaccinated person can give it to someone who, or in their household, who has not been vaccinated, but the risk is much lower. And that's what it's all about, getting vaccinated so that you're not carrying that forward and you're not at high risk for giving it to anyone. So, the mantra right now is get vaccinated so that your risk of giving it to someone else is lower. So the short answer, yes, it can happen, but it's unlikely and few and far and few between.
Okay, any other one of our panels want to jump in there and take that question about vaccination in the household?
I think Dr. Ford is 100% correct in that, but just from personal experience in my own office, we have someone who was fully vaccinated who ended up, developing COVID. She was very mild symptoms, but still she came up positive. So, as much as we, want to get back to a sense of normalcy with vaccinations, we haven't gotten there yet, and we still need to be super vigilant about what mask wearing, hand washing, social distancing, and all the other precautions that we put into place thus far to get us to this point so that we can push through this. So, I know we're supposed to be talking about vaccine hesitancy, but we also have to be COVID realists and know that this is not over, and we need to kind of work through this.
Now we were off screen before the webinar started, and you were speaking about your employee that got COVID. So actually, what did the vaccine do for her? Because that's what a lot of people don't realize. I think he must be on mute.
But who's that direct? Is that the director for it?
I think Dr. Straker was trying to ask him something because he made a point about his employee getting COVID. You know, what I found with some of my employees in the emergency department is they get the vaccine and then they get careless. They kind of let their guard down before they had their full immunity. And then they wind up, they've got their vaccine, but they go out and catch COVID and trying to dispel that myth that it has something to do with the vaccine. You know, it has to do with you letting your guard down, not masking up, not doing your social distancing like you're supposed to until you get your full immunity, not to mention still doing it after that. And I think we should make one point that I think Mike had told his employee is the vaccine is working. You may have gotten COVID, but you had a very mild illness. You didn't go to the hospital. You didn't wind up on a ventilator, and you didn't die. So the vaccine is doing its job.
Right.
It's to guard against, you know, severe disease. You may have a very mild case, which passes very quickly, but we still need to remain vigilant.
100%.
Okay, Dr. Aluya, I got a question for you. What are the ways that I can keep my children safe from COVID-19, especially as they return to school and as they participate in sporting activities and other activities?
Well, thank you for that question. And it's great in the sense that as we approach, you know, this curve of our having our kids going back to school and attaining some form of normalcy, which I mean, the complete normalcy like we knew it before would in another 2 to 3 years would not be. I'm sorry, but that's just the way it is. With out of I think 75.2 million young children and adults less than 18 or less, and 50.6 of children who are in the school age that are going back to school. The essence is for our teachers, our community, and parents, and of course those in government or leadership should, you know, get involved and get engaged in this aspect to make it smooth enough for us, you know, for our children to go back to school and make it safe for them to go back to school. Other than the standard precautions that needs to be taken, you know, kids need to wear their masks still, social distancing as much as possible. And individual states, individual counties, and even schools are taking, you know, specific steps to protect their children and teachers. As a matter of fact, one of the steps I would, you know, of course, advocate is one, ensuring that all teachers are vaccinated. That's one, because I had to give a talk once to COVID talk to teachers. And in that respect, I did say this, that it's important because, of course, we have vaccine hesitancy among teachers as well. So, and I gave this analogy and it gave them a better understanding of it. Because when you get the COVID virus, I give the analogy of saying, for instance, the virus has all those strands that you see. Let's say there are 10 of them, and you get the virus into you. As soon as it gets into you, all the virus with the 10 strands get into you. Now, they replicate and then come out to infect somebody else. So for an unvaccinated person, what you're going to come out, the virus that's going to transmit to the next person would again be a virus with 10 strands or even more because of the, you know, mutations that begin to take place as we hear all about. Now, for somebody who's vaccinated, especially for teachers, and they got this, it made sense to them. For you who's already been vaccinated, if you do get the virus again, the difference is that your immune system is already primed and ready to recognize the virus and be able to beat it down. And when it does, you're going to beat down those strands. So rather you know, when the virus gets into you and it comes back up again to infect somebody else, rather than having 10 strands, you're going to most likely have a virus with 7 rather than 10. So a virus with 10, spikes and a virus with 3 spikes because 7 have been taken off, which one would you prefer? So of course people understand, that analogy. Because when you come out, you're going to infect, and God bless our children. So for those kids, if you're going to infect them, you're going to give them a virus that most likely a 3 strands or 3 spikes. So obviously the virus is weakened and is less effective in causing disease and debilitation, and you ended up in the hospital. And when I said that, I gave that analogy, and they did understand that and saw the reason why they needed to be vaccinated. Now, on the second aspect is, again, to see if, because for schools that don't have the same amount of space to cater for the social distancing, you can stagger those who come in, in the sense that certain number of kids who would create a bubble can come in on certain times, maybe on Mondays and Wednesdays, and another bubble will come in on Tuesdays and Thursdays. So doing it that way would really do help, again, mitigating the spread of the virus. And of course, wearing the mask and everything else, and ensuring that the teachers and the parents are vaccinated. Now, we're talking about vaccines for kids. Of course, Pfizer is working in earnest for children aged 12 to 16 to be vaccinated. And of course, there are other ones that are still coming all the way down to infants. On the long run, another maybe 2 years or less, we'll have vaccines that will cover all age groups. So these are the steps I would suggest that parents and the community advocate that, to protect our kids as we go back to school.
Okay, thank you for that very informative answer. I just wanted to ask Ms. Dungy, did you have any advice to parents who are wary of the vaccine? I know you've had some background in the neonatal unit. Maybe you have some way that you communicate with the parents. Anything that you would want to express?
Sure. Thank you for that question. Like you said, working in the NICU, it is imperative that we, have that discussion with parents. I also think that it's important for parents to know that children are not immune to COVID. So although their risk appears to be lower, and most of the time they are asymptomatic, they can pass the virus on, to grandma and grandpa and auntie and uncle. So it's important that we educate ourselves. I'm always encouraging of families to have conversations with your pediatrician about your concerns, and to just try to educate yourself as much as possible. I know that, with children, studies can take a much longer because, their immune systems are very different. They're ever changing when they're small. So I can understand that there being a hesitancy, but I would always encourage parents to have conversations with their doctor, with their pediatrician, and to, to do their best to, keep them safe.
For that informative answer. I think one thing I'd like to interject in here, we kind of encourage people to get the vaccine because we don't want them to get severe disease, wind up hospitalized. But I think sometimes it goes overlooked, the long-term effects, the long haulers, the people who are sick for several months with, different symptomatology, headaches, don't recover quickly. That's also very debilitating. So, that's another plus that you're going to get from vaccination, not having to deal with that long-term illness. Okay.
If I could jump on that a little bit, I mean, and our internal medicine doctors can probably expound a little bit, is that long hauler syndrome is not specific to those who have had severe disease. So you may have had mild symptoms, recovered, and then weeks later develop these other symptoms which are worse than what you had when you had COVID. So, we've said this in the past, Dr. Giles, is pick your V, either the vaccine or the virus, and the virus doesn't always have an immediate problems or an immediate severe effect, and it could be those long-term effects that you don't want that. So vaccination will help to protect you against those long-term symptoms that we don't know how long they're going to last. We don't know if they'll go away. So it's important.
Right. That's. If I may add to that, Dr. Stryker, you did bring it up, severe, hit a point there. Often enough, we think those who get severe illnesses are the ones that come up with a whole long hauler syndrome, but no, not really. A few people who've had very minor symptoms come up with long-term debilitating effects. One thing that was written about 4 weeks ago now was the neuropsychiatric issues that happens with people with mild COVID, and of course a lot of them have ended up in a psychiatric hospital, repeated admissions and stuff like that. So this is a virus. We're still trying to learn as much as possible, but with viruses, that short-term complications and long-term complications, and those long-term complications are what we're beginning to see now as long haulers. And of course, some of them can be neuropsychiatric, and we need to pay attention to that.
Yeah, I'd wonder, Dr. Williams, are you seeing some of this?
Yes, absolutely. Everything from the overwhelming anxiety that's reported from patients that have already had COVID to even intra-infection, the at times delirium that's been noted by some of my colleagues when it comes to if they were hospitalized. So yeah, we've seen a full spectrum depression, all of it, when it comes to this situation. And there is some speculation from the psychiatry section of JAMA that we still don't really know exactly how expansive this is. This could be up to a third of those who have experienced COVID one way or another that may have some form of neuropsychiatric presentation within the year. So, we still may be on the uptick with that, even as the numbers with COVID at some point drop down. So that makes it even more important if there's anything we can do to head this off, if people can get the vaccine so they don't have to go through that part of the process. There's always going to be an emotional part of this, and there's always going to be, as we've called it, hesitancy. It's fear of the unknown. We can't say that we knew everything about this virus when it happened. We can't say we knew absolutely everything that was going to happen once we started rolling out the vaccine, but at least we have now some control of those other factors. And basically, you have a choice now. You can do something or you can do nothing. And we've already been through about 9, 10, 11 months of what happens when we quote unquote do nothing. And now we finally have the opportunity to act. And that's where we get to take charge. So that's what I think the underlying message is here.
Yes, and we know doing nothing didn't turn out too well.
Just to piggyback on what Dr.
To add a little bit to that, I'm sure Dr. Williams would talk about this, or he's seen this. There's an increased rate of suicide among the young. I'm medicine and pediatrics, so I see children as well. Estimated over 2.5% increase in suicide ideations and suicide taking place among the young in the community, and increasing rising number in Black community. So we need to pay attention to this and say, the young, they don't get severe symptoms, but on the long run, things will happen, and seek help when you really need to seek help. And family members should pay attention to their families. And a little shift onto that. One of my psychiatric a friend who on a panel, the Physician Health Network, we do talk about this. And he said, this is no time to take away, those avenues where children get in contact with their friends, because everybody's home, they're stuck at home, and the only way of relief from that stress and anxiety is getting in touch with their friends and colleagues and brothers and sisters via social media. So if you want to punish your kid, this is no time to do that.
Okay, I think Dr. Ford was trying to jump in there.
Piggyback on what Dr. Williams was saying. That JAMA article did say that 1/3 of the people who did contract COVID would come down with neuropsychiatric complaints consisting of mood disorders, anxiety, depression, and dementia symptoms. But one of the most striking things that I found in that article was that up to 45% of the people who had to go to the ICU experienced those symptoms. That's a big jump, and that's very, very significant. And for anyone sitting on the fence wondering if they can wait this thing out, if they should not get the vaccine, when you present those figures to them, those figures are additive onto familial types of dementia and other things that cause dementia. It's not separate from that. So we're talking additive things. So 145% if you go to the ICU, 1/3 if you have of the people who get the COVID will have these symptoms. That's a huge, huge number of people, and I think that's one of the best cases for getting the vaccine.
Okay, thank you for those statistics. Dr. MacArthur, so women of all races are concerned with this vaccine in pregnancy. We know that pregnant women were not part of the clinical trials. So what advice do you give to patients when they ask you about getting vaccinated?
My advice to people is pregnant people were in the trials, even not by intention or design. Some of the people during the trials got pregnant, or some were and didn't know. So they had some evidence in the first 6 months as the vaccine was rolled out that there seemed to be low risk of any adverse effects. The two, ACOG wanted people to be included in the trials, but they didn't get their way. And what we would say now is because there's a low risk, you should discuss it with your physician and come up with a plan as to what you're going to do. But I would say pregnant people who get COVID, especially people of color, have a greater chance of having serious disease, increased risk for hospitalization, increased risk for ventilatory problems where you end up in an ICU, and definitely an increased risk of premature babies. So at the end of the day, if it's a low risk to take the vaccine and avoid all of those things, why wouldn't you take the vaccine? And I think once you have that heart-to-heart conversation with your patients, they're not going to say, oh, I don't want to take the vaccine. They're going to say, where do I go to get this vaccine? So that's the thing now in the clinic that I work at Barnabas. We encourage, our clinic is predominantly people of color. People are coming and asking, is it okay? Can I have, in some places we're making them get a note to say, yes, we've said they can have the vaccine. Because even within the doctors, people are hesitant with pregnant people, but they should take the vaccine just to avoid all of those things. And again, part of the process is explaining that this is not new technology. I like to say the mRNA, people got very excited about warp speed. That was for the people who watch Star Trek. And we moved up to, okay, it's just very fast. My thing is for young people, it's like Instagram. It's an Insta story. You get the protein, the messenger RNA gets into your cells, not your nucleus. And like the Insta story, it goes away in 1 or 2 days. It's not there. It was there long enough to pass the message along for the cells to make the antibodies, and that's it. If you have the antibodies as a mother, you can pass that on to your baby. So there's benefits for you and your unborn child if you get the vaccination. So sign up for the vaccination if you're pregnant.
So it's kind of like Snapchat, where you used to be able to take the picture and it would disappear.
Yes, very much like that.
Okay, Dr. Straker, are you finding that you need to make any plans with your patients who are planning to get pregnant, or kind of, doing their family planning?
Yeah, I think like Dr. MacArthur said, part of it is having the conversation, and a big part of it is dispelling the myths. And pregnant and non-pregnant patients alike, when I'm in the office and I'm discussing, one of the first things I'm asking folks now, are you vaccinated? Just to bring that question to the light. And a lot of those folks, a lot of them will say yes, and I appreciate that. But a lot of folks, the first thing they'll say is, I'm not sure, or I think I'm gonna wait. And then my first question is, wait for what? What are you waiting for? That really is the way to kind of segue into that hesitancy. Why are you hesitant? What is it about the hesitant? And then once we start discussing how the vaccine was created, like Dr. MacArthur said, once people realize that one of the main researchers was an African-American woman, people's eyes light up and like, oh, okay, really? I didn't realize that. Once you tell them that, there were African-Americans on the FDA committee to give the emergency use authorization, people start to understand that once that we have access. That's one. We've had a say in this process. And I think once they realize that we weren't left out of the development of the vaccine, they feel more comfortable knowing that I don't think someone that looks like me is going to try to create something that's going to harm me. So that's one of the ways that I kind of get over that hump with this hesitancy is, okay, you just get people thinking about it a little bit differently. So, and then do we come up with a plan? Not always come up with a plan, but they are able to lead with knowledge that gives them power. And that's really what it's about. So, sometimes they are concerned about, when do I'm interested in taking it, but when do I take it? A lot of times, just to be on the safe side, I'm telling patients that Dr. MacArthur can probably, corroborate this, is that we're telling people to, if you're really thinking about taking it, it's probably better to wait until the second trimester. Therefore, if anything, God forbid, would happen with the pregnancy, we won't really kind of correlate that with the vaccine administration. So
it won't confuse the issue.
Correct. It won't confuse the issue because, unfortunately, if it ain't pregnancy, there is a percentage of pregnancies that will have a first trimester loss. So we don't want to confuse that. But honestly, we're not finding that there's a specific trimester or specific time frame that needs to be that you need to wait in order to give the vaccine. So like Dr. MacArthur said, get it. If you're thinking about it, get it. If you're unsure, let's give you the information to make that decision. But I'm also of the mind where I'm not here to badger you into getting it. I'm here to give you information in order for you to make an informed decision.
Exactly.
I just would add to what you said, Mike. The reason why I tell people if you're in the first trimester to wait is sometimes some people have fever after the vaccine. In pregnancy in the first trimester, whether you had a vaccine or just had a fever isn't good. Yes, you can take Tylenol if you got it and you do get the fever, and hopefully you should be okay. But just to take that out of the picture, wait until after the first trimester, or either do it before. If you're thinking of getting pregnant, do before you get pregnant, then you don't have to worry about it. But it's certainly safe to take before if you're seeking a pregnancy. And if you're a breastfeeding mother, yes, again, some of that little antibody stuff may go through the breast milk, but it's nothing that's going to hurt your baby. So you can breastfeed if you've had the vaccine.
And
that's interesting because I was reading an article where some of the moms who had the vaccine, and once they discovered there were antibodies in the breast milk, they were actually pumping and supplying their milk to other folks in the community so the kids could get exposed to those antibodies as well. Now, I think there's someone in the chat which has a question. I don't know if Stacy, if you can see their question. I see they have their hand raised.
Yes, we have two so far. The first one is should healthcare facilities, hospitals, clinics, doctors' offices mandate vaccines for employees?
I can tell you in my emergency department, it's highly encouraged. It's not mandated because there are so many differing opinions about it. And I must say, I probably have a daily conversation with my staff about getting vaccinated. And some of them are still against it, despite the fact that they're on the front lines. They're watching people come in with severe disease. They're watching us put people on ventilators, admit them to the ICU. So I don't think they made that step to make it mandatory, but we definitely try to encourage our staff about it.
Well, if I may add to that, mandatory, no, but the word is strongly encourage, especially if you work in the healthcare industry, to take it. First, to protect yourself, and of course, to protect somebody else. Some of the study, which I must give a great kudos to Mr. Sterry, who's the president and CEO of Newark Medical Center, and his staff, they did a study which kind of showed in line with what was happening in the country, where 65% of those Caucasians are taking the vaccine in the hospital, about 15 or so in the Hispanic community, and about 9 to 11 in the Black community within the hospital. So he took this very bold step where he went on one-on-one with physicians, including myself. We took each department, security, housekeeping, nursing, and spoke to them directly one-on-one, where they all came up with their questions, and we had to answer those questions and make them, become comfortable why they need to take the vaccine, make them understand why they need to take it, and what use and purpose it is to take the vaccine. Because again, I say this, if you make somebody understand why they need to do something, they will accept it. So for us, our end, again, to the credit of Mr. Terry, who did such a great job in talking to them directly, yes. So it became not just a hesitancy, but a deliberation. Because a lot of people are a little hesitant, but all they just need is that deliberation to talk to them and make them understand why they need to take it. And of course, a lot of people signed up right there and then, and the number has increased. And we hope to see another study to see what that impact has had in the hospital community.
Yeah, that education is key. Like Mike said, informed decisions. A lot of times they're saying they don't want to do it, but they really don't have all the information, which is vital to making a decision.
Dr.
Anyone
Giles,
else want to jump in?
Dr. Giles, we have another question.
Okay.
What specific counsel would you give to early childhood teachers who are hesitant to get the vaccine?
So I guess I'll take that question then. We alluded to that question when I was asked about that. First, maybe we have to put them in a cohort where teachers will have a Zoom meeting with teachers. I had done one. Maybe we need a bigger platform to talk to teachers. Maybe we'll talk to the teachers union to have one so that doctors from the community, especially the Black community as well, come on to talk to them and make them understand why they need to take the vaccine. That they do need not just to protect themselves, but to also protect the children as well, so that the children don't get the virus from their teachers or from one another, and then go on to spread it to their families back home as well. So it's really important: education, education, education. And I'll say this: there's the New Jersey Medical Association, who I was just the immediate past president of the New Jersey Medical Association, the Association of Black Doctors in the state of New Jersey. It's a New Jersey chapter of the NMA, which is the National Medical Association. We've put words together, brought some great doctors in, Black doctors in the community, where we talk about this and try to encourage members in the community to take the vaccine and understand why they need to take it.
I can even dig in a little bit more on that. Although she's doing her own thing right now, my wife is a special education teacher dealing with preschoolers, including diagnoses such as autism, which when you think of the ideas of social distancing, wearing masks, and all the other possible behavioral components, and children not being able to be vaccinated, that also makes them vectors. And a vector means even if they don't feel sick, even if they don't actively have signs of infection, then that means that that household could be at risk if they are all together. So teachers are definitely a unique group where they get exposure in different ways than most of us would think about in our day-to-day lives and our jobs. So from that standpoint, I know that she's been an advocate for her staff and for her colleagues to get the vaccine, because otherwise we're really talking about the Wild West. We don't know unless people take that next step forward. And obviously education is the number one key to all of this. If there's a concern amongst the staff, then I know it's already been alluded to by Dr. Aluya that teachers talking to teachers may be the most impactful way that you get that message across, because I consider them, obvious bias ahead. I consider them to be incredibly knowledgeable and incredibly, active in making sure that society is on the right path. And so I know I've definitely, I didn't have to preach it in my own household. My wife was actually a great advocate, but she sees the hesitancy in her areas as well. So that's, it's great that someone asked that question in the first place, because I think a lot of times, even as professionals, as healthcare professionals, we get this idea that we all have similar thoughts, and that may not be the case if no one comes forward.
This one is more of a statement, so I'm just going to read it, and if somebody has a response, jump in. It is very difficult to be locked up for such a long time. It is really affecting some children, not all of them, but the majority. This is really a challenge for everyone. And then there's another question. How long should I wait to get the vaccine after having COVID?
I think within our health system, it's a 90-day period. I think some folks have been hesitant to get the vaccine after they get COVID because they just assume they have antibodies. But what is unique about the vaccine is it's a planned trigger type of immunity. It's focused on, providing the appropriate antibodies for that spike protein. So there are many areas of the virus that your body can react to. So you're not exactly sure of what's your volume of antibodies, what your antibody is, going to react to. But with the virus, it's been, strategized what is the most appropriate way. It's been studied to see that it's effective. So we still recommend that people, if they have had COVID, that they get the vaccine. But usually from my facility, it's usually a 90-day period.
Yeah, I think, with regards to the recommendations out there is still to wait for 90 days. The essence of that is we still don't know how long the maximum immunity that you accumulate would last. I think the latest reports show that about 100 million Americans who got the COVID vaccine may have the natural immunity. But the essence is we don't know how long that will last. They purported then in the early stages that it may last for 3 months, and that's why they talked about the 90 days, as compared to when you get the immunity from the vaccine. There's like I just said, that may last longer. The jury's still out there. On how long that will last. Hopefully, it will last as much as we can, a year or more, so we don't have to have a booster within the next year. So we're still waiting for that.
The next question is, how long after having the vaccine should women wait to have a mammogram?
Oh, I'm going to answer that one. Some people after having the vaccine have developed some axillary lymph nodes. If that happens, they tell you wait 3 months before you go get your mammogram. So if you do your self-exam, you don't feel any masses, you can go ahead with your schedule. But if you've developed some masses, you should wait 3 months.
One more question, and then I'll read the last question. There's a lot of hesitancy within the Latino community that I work with, even limited communication with those who test positive, which can create additional stress on the parent and then the child. So that's just a statement. Next question is taking mask breaks permissible for students with the exception of meal times while in school? Is taking mask breaks taking a break from wearing your mask permissible for students with the exception of meal times while in school? I guess this person is concerned about their child wearing a mask for the full day of school. Is it okay for a child to take a break from wearing a mask?
Right. Well, I think the approach to that should be in two prongs. In the sense that for those who are age 16 and above, who are in high school, college, or school, who've had the vaccine, I mean, the recommendation now is if you've been vaccinated and you leave or stay or cohabit, with individuals who have been vaccinated, you basically can leave without, putting your mask on. But of course, if you live in that environment within your bubble, you need to put on your mask. Now, for kids, it's really difficult to ensure that they put on their mask. But then, you just have to encourage them, to do that. But of course, if they have to eat, then they take off their mask. And if there's any issue with respiratory distress or problems, then of course you have to take off the mask. But then, again, it's encouraging them to put on the mask and ensuring that social distancing is adequate and ensured.
And this is a final question. Taking the vaccine is ultimately participating in a clinical trial. What protections do vaccine recipients have in the case of an adverse event, given that Pfizer and biotech have been given immunity against any kind of accountability?
Anybody wants to take that? Well, I think that's a politically inclined question. And yes, the whole story of immunity to manufacturers of vaccine just didn't start today. It's a long story because let's call a spade a spade. I often ask patients of mine who come and when I give speeches, when was the last time you saw somebody with polio? None. I mean, other than the fact that in this country and most developed countries, polio has been eradicated. But if you look globally, there were just only 3 countries that still had polio. Thank God Nigeria, where I'm from, I was born, has been taken off that list finally in 2018, but Afghanistan and Pakistan are still on that list. Now, if you look at smallpox, chickenpox, so everything, you don't see those things. So, but with all the anti-vaxxers and those people who are resistant to vaccine, a study came out and said 20% are resistant to vaccine, meaning irrespective of what you say or what you do, they're not going to take it anyways. And those are the ones who are perpetrating and pushing this agenda out there with the adverse reactions and all that. But thank God with the mRNA technology and where we are right now, we're safe enough with this. We haven't had those very debilitating adverse reactions, with the new technologies that we have. Again, I think those issues on the political space came about in the sense that so that nobody would just come up and begin to sue those industries arbitrarily, because anybody can sue anybody for any reason. But then, what are the positive outlooks and outcomes? Do they save lives? Yes. But otherwise, if I set up my vaccine, manufacturing company, and me trying to save lives, and I have 10, 20 people sue me because they have a fever, I'm going to close shop, and all the lives that I'm going to save will be lost. So I think on the political level, that's a long span, message coming up. But on this, where we are right now, I mean, if you see the studies with the J&J, mRNA technology, not serious adverse reactions. But the J&J, I think they said 16 people did come up with adverse reactions, and they had the average age of 35. Out of the 16, 15 are females. 3 ended up dying. But then, compared to about almost 7 million people who took the vaccine. So if you do the math, that's 0.002%. That's 3 zeros in front of the 2. So look, does it save lives? Yes, it saves lives. Other issues can come up. People die every day from other issues. somebody is going to die tomorrow from a heart attack or whatever, I gets the vaccine today, you blame it on the vaccine. So, but the essence is this. The efficacy, does it work? Yes, it works. Does it save life? Yes, it saves life. Does it help us advance us towards going back to normalcy? Yes, it does. So, and that's why we're here, so that we can encourage individuals to take the vaccine, so that we'll go back to saving lives and livelihoods.
And if I can piggyback on that a little bit, I totally agree with what you said, Dr. Aluya. And that's one of the things that I discuss with my patients as well. I mean, if you take the number of people who have already been vaccinated in the United States, almost 100 million, and then
I think it's probably about 200 million now.
Right, 200 million. Then I ask my patients, of those 200 million, how many news reports are we hearing about severe adverse effects? And people always look up and they say, not that many. I'm like, well, there's your clinical trial. You know, the first people to be vaccinated were in the clinical trials back in March of last year. And of those 30,000 people, it was deemed safe enough to push it out to the public. And now, correct, we are all part of this clinical trial, and you have not heard of a vast majority or a large number of people who have long-standing problems from the vaccine. Yes, we don't know. It's only been a year, but in that year, what have we seen? And we have not seen that large number of people with adverse reactions or adverse problems from the vaccine. So, we have to kind of look at it, take a step back and look at it realistically, like Dr. Aluya said. If we take the a vaccine off the market because 12 people had an adverse reaction, all those other millions of people who have taken it don't get the opportunity to protect themselves from COVID.
Yeah, if you just want to talk about some statistics, the politicization of it is probably one of the reasons for that overreaction with the J&J vaccine, because they pulled it off the market, but there were actually 6 cases in almost 7 million people. So that's less than 1 in a million. With the flu vaccine, there's 44 portal thrombosis cases in a million, but it's still okay to give the flu vaccine. That's highly accepted. It's a yearly campaign. So if you're not concerned about 44 in a million, why would you be concerned about 6 in a million? But that's the environment we're living in, where everything gets politicized. It's the headline of the day, and everyone just latches on to it. But 6 and 7 million, the benefits far outweigh the risk.
Just to add to what you were saying, when you do get your vaccine, sign up for the V-Safe program, which is one way they have of getting more information about the vaccine. It's a program where they will reach out to you by text to follow up how you're doing, what kind of side effects you're having. That's going to give more information for pregnant people and for people in general in terms of what they can expect. So when you get your vaccine, sign up for that. They will reach out, and that's how they're going to gather information to give us more information on the vaccine.
Okay. Yes, please go ahead.
Oh, I was just going to say that, in the final analysis, the government views this as the benefits of getting the vaccine greater than the risk. And it's going to be hard. A person will be hard pressed to try to sue the government for anything that goes wrong when they're trying to tamp down a pandemic. You are your best advocate. Always advocate for yourself. Speak to your healthcare providers to make sure that whatever you choose to do in terms of this vaccine, that it's in your best interest. Because if you don't do that, then no one else is going to do it for you.
Okay, Stacy, did we have another question in the chat?
No, that's it for us.
Okay, so this is a question for everyone. So it's been bandied about, we all understand herd immunity, but we want our attendees to understand that. So why is herd immunity or community immunity so important? If I could just get the panelists to kind of weigh in on that.
Mm-hmm. Can I start? Okay.
Yes, absolutely.
When many people get the vaccine, the virus will stop spreading. I liken this to almost a neighborhood that has a mosquito infection and people are getting ill. If your city government says, I want everybody to close your doors, put screens in, then the amount of infected people will obviously go down. So what they're asking here is for the virus to be, the vaccine is sort of like your screen door. you're preventing community spread by tamping it down. And hopefully, the more people that close their doors or get a vaccine will suppress this vaccine to the point where we don't have these variants that keep popping up.
I don't know if I'm aging myself, but it's almost like when our parents, when one of the kids in the neighborhood had chicken pox. This is not recommended now because we have a vaccine for
the pox party.
But yeah, you would put those kids in the room and hopefully, everyone would get chicken pox. So eventually it would not continue to spread out the neighborhood. So getting to a point where we're not spreading, like Dr. Ford said, the virus around is really what that community immunity is, and then eventually the COVID will kind of peter out. That's the concept.
Right. I mean, they talk about what percentage do we need to attain to get herd immunity. I mean, some people say 70% on the average bar, but that's based on historical perspective of other viruses. Hopefully, this will behave the way other viruses behave. It's still a virus, in as much as it is as deadly. But then, for us all to get there, so we all need to, vast majority of us need to be vaccinated, so that we'll begin to protect ourselves. So that issue of the variants that come up from year to year will be so much less. And even when they do come up, people will not be that sick. I mean, I understand that even with the flu vaccine, almost 30,000 or 30-something thousand people die every year from the flu in this country, despite the fact we have vaccines. So we don't want another situation where we begin to have a perennial vaccine virus, including the flu virus, as we already have. So we need to learn to protect ourselves and take the vaccine so that we all get that power to dampen the effect of the virus in the near future.
Anyone else? Any other thoughts? Stacy, how we doing on time?
We have no more questions in the chat, and we've also posted the link for those who may want to register to receive the vaccine at one of our facilities.
Okay. All right. So let's just close it with, in partnership with communities around the state, the COVID-19 vaccine is available at many Robert Wood Johnson Barnabas Health facilities. We also have the Middlesex County Mega Site, that's the New Jersey Convention and Expo Center, and other affiliated sites. To register to receive the vaccine, you can go to www.rwjbh.org/COVID-19 vaccine, and they will place you in the queue based on the priorities for vaccinating different groups. Any other questions? Anything else that anyone wants to bring to light?
Well, I think at the end of it all, I must thank each and every one of you for doing this. I'm sure we've all been, vaccinated. I have been, and I'm sure everybody else, by show of hands, have been vaccinated.
I hope so.
These are all Black people, all healthcare professionals who are Black. And like I always say, listen, we don't want to die as much as anybody else don't want to die. And we are out there standing for you as advocates. So hopefully, thanking, the Robert Wood Johnson Healthcare, Barnabas Healthcare System, and other entities who put this together to inform our community about the value and the needs and the purpose of, making us understand why we need to get the vaccine so that we can save and protect ourselves and protect our community, because everybody else is taking it. Now, we don't want a situation where we already do have a healthcare disparity, that we're creating our own disparity by not taking this vaccine.
Yes.
On ground in another 2 to 3 years, when the whole thing has been given and the other races or other people have taken it, we haven't. Look, politics do change, policies do change, and conveniently, the pressure, the money, the time, efforts, and everything else, and the attention, media attention that's put on COVID right now will no longer be here. And then we're already dying right now. In the next 2 to 3 years, when we create this disparity, who else will now be dying from this disease? You'll see that we are creating our disparity by not taking the vaccine. So please, for those who are out there who've listened, I hope you understand why. Black doctors are out there making effort for us to take the vaccine. Please do take it. And hopefully we have made you advocates as well, so that you can speak to your church, your mosque, your family, friends, because they'll listen to you as well, because you understand better now. And if you're in doubt, speak to your doctor. Have a one-on-one and reach out to any of the doctors via the website, and we'll be very ready to talk to you.
If I could bring up one particular point. So we're on this webinar, we're talking about vaccination, but what do I do if I get infected and I haven't had my vaccine, or I've had my vaccine, I haven't had a chance to get for my immunity to develop? We have a very robust program at Clara Maass. I know they have it in several other systems where they give synthetic antibodies, and we found those to be, life-saving measures and also blocking severe disease. So what I've seen, a lot of times, which is puzzling, is patients will come in and say, well, I've had a cold for 3 days. In the era of this pandemic, it's COVID until proven otherwise. Nobody has a cold until you go get tested and it's not COVID. And if you are tested and you're high risk, you're a candidate for one of those antibodies. So if, elderly people over 65, immunocompromised, diabetics, those are automatic inclusions for that antibody. Or, people who are very heavy, overweight, BMI greater than 35. If you have, hypertension or heart disease and are over 55, and that BMI criteria goes all the way down to age 12. So even for heavy adolescents, they're also candidates. So you want to keep that in mind. So we just want to give you as much information as possible so you can be advocates for your family, provide them with the most up-to-date and real information, and not some of these, misinformation out there on social media.
I just wanted to say, already we've lost more than 570,000 people in this country. Nobody's talked about it, and I guess most of us assume that people know, but the vaccine is free. It doesn't cost you anything. Take the vaccine and don't make it cost you your life.
Thank you.
Yeah, last thing on my part, Pixar didn't happen, so that's me pointing out that I got it. I'm grateful that my spouse has the vaccine. I'm grateful that my parents, one of whom has a very severe dementia, was able to get the vaccine. I'm grateful that a colleague of mine who basically was a long hauler, who is still doing telemedicine, meaning he's working from home. Thankfully he is working again, just started working this week after being out for months. So I've definitely seen it at every level, seen it impact people in ways that we can't imagine, from an emotional standpoint, from a psychological standpoint. And if you could save yourself that grief, not just from the illness itself, but for all the damage it causes from the illness and the death that people have had to deal with, that didn't even get a chance to grieve because they didn't get the chance to honor their loved ones the way they would if we could have regular contact. All of those things have been coming into play for over a year now. And if we can actually use this as a way to start to transition that in some way, shape, or form, then, my goodness, I really hope that, even if it's one person different after all of this conversation, I can't pretend to change people's minds or hearts, but I can give them, my perspective as a human being. And sometimes that's enough.
Yeah, I totally agree. Oh, Lee, you want to? I'm sorry. Go ahead.
I'm sorry. I was just going to say, I echo what everyone is saying. I am grateful for the opportunity to be vaccinated. I am grateful that my 70-year-old parents were vaccinated and they never get the flu vaccine. They are completely against it. They won't do it. We unfortunately have suffered some loss from COVID in my family. And I think, you know, as a healthcare professional and working every day through the pandemic and, you know, going home and telling, you know, sharing the stories with my family of what I saw, you know, I think it was kind of a wake up call. So, you know, I've been a nurse for 16 years, and I know that's no time to some people, but, you know, like I know that all of you here on the panel can say that, you know, the last 18 months have been something that is unprecedented, that we have never, ever seen as healthcare professionals. And I truly wish to never see again. So if I myself can be a part of making that change for the good and keeping people safe and saving lives, then I will continue to advocate for the vaccine. I'll continue to do my best to educate others that I speak to, because, you know, I know it's cliche now, but we are all in this together. You know, it's going to take all of us to pull together to eradicate this virus.
Yeah, I totally agree with that, what everyone said so far. And I'm, again, fully vaccinated. My wife is fully vaccinated. My parents, my grandparents who are in their 90s have been vaccinated. So it's been a blessing. I definitely want to thank RWJBarnabas Health, and I want to thank the North Jersey chapter, the Lynch, for being intentional about, you know, bringing, you know, knowledge to the community at large and to the African American community specifically. Because without that intention, you know, we kind of lose out. So you have organizations, medical organizations and community organizations who are really looking out for the best interest. Neither one of these groups, you know, are profiting from from giving these talks, and none of us are profiting from giving the talk. We really are in it for the ability to be able to give good information and hopefully, you know, help people make that informed decision. And I'll say it again, you know, for me, pick your V. We know that Dr. MacArthur said more than 570,000 people have died from this virus. You know, so do you want that V, which is the virus, or, you know, the V with some of the questions, which is the vaccine? Every day, all day, I do not want to be one of those 570,000 people. I'm going to take the vaccine. That's me. So hopefully some of the information we've given you will help you to kind of, you know, move into that direction of considering vaccination if you're hesitant.
Okay, I want to thank everyone for participating, for giving us the value of your time. I know that you're committed to the community because, like Mike said, none of us are getting paid for this. This is just for the love of our people and for trying to make sure that everyone makes a wise decision in regards to their health. And we can try to head off this deadly pandemic. You know, I'm sure losing over 500,000 people was nothing that we were anticipating. And as Leah said, we don't ever want to go through this again. So let's everyone get ramped up and trying to defeat this virus.